Yes, Doctor, we can start, please.
Hello.
Hello?
Hello, I'm Dr. Manazir, one of the senior house officer in general medicine outpatient today. Am I talking to Mr. Ahmed, 30 years old man?
Yes,
30
Doctor,
years
I am.
old?
Yes, Doctor, I am.
Nice to meet you.
Thank you, Doctor.
Mr. Ahmed, if you don't mind, we are here today to discuss some issue related to your health status. Is that okay with you?
Yes, please, Doctor.
Okay. During our this discussion, I will write some notes. It will be highly confidential. Is that okay with you?
Yes, Doctor. No problem.
Okay. Okay, Mr. Ahmed. Uh, can you tell me more about your health status, Mr. Ahmed?
Actually, Doctor, I am suffering dizziness since around 3 months, but nowadays become more.
Okay, I'm sorry to hear that. So, Mr. Ahmed, how did you mean exactly by this dizziness?
Actually, I feel like lightheadedness and a tendency to fall down and collapse.
Okay. Did you lose your consciousness, or you don't remember
No,
that?
no, no, no. I
Okay.
keep I keep my consciousness.
So, what's happened exactly before this spell came to you?
Actually, Doctor, when I am trying every time to stand up, I feel like dizzy and I feel like I will to collapse.
Okay, you feel hunger. You feel like that hunger, sweaty.
No, no,
No headache before this dizziness,
no,
shaking of your hand like that things.
no, Doctor.
Okay, this dizziness is came for you before this 3 months, or this just
No,
for
Doctor.
this
Only started about 3 months. It was infrequent, but nowadays it come every time when I am trying to stand.
every day? It come to you
Yeah, yeah,
every day.
yeah, yeah. Nowadays, yes. Nowadays it increased. This.
Yeah. Okay, sorry about that. So, Mr. Ahmed, what happened during this dizziness exactly? You mentioned you didn't lose your consciousness. So what
Yeah,
happened
Doctor.
exactly? Hmm.
I feel like I around to collapse, but when I try to sit, I feel better.
Okay. For how long this period start? For how long this dizziness
On,
spell
only, Doctor. It last second. Only seconds it last.
last? Okay. And after that, you feel well, no
Yeah,
any
I
problem
feel
or what?
okay. Yes, yes, yes. I feel okay after that.
Okay. Okay. Yeah, Mr. Ahmed, this dizziness, is it increase exactly when you standing from sitting position like that?
Yes, yes, yes.
Okay. Since you start like this
Yeah, yes,
from sitting.
Doctor. Since 3 months, yes. When I try to stand, I feel this dizzy.
Okay. Is there is any symptom associated with this dizziness during or after symptom you want to mention?
No, Doctor, I can't appreciate anything.
So, Mr. Ahmed, did you feel any headache after this symptom? You said no
No,
headache,
no, no,
no
Doctor.
blurring of, yes, okay, no blurring
No,
of vision or loss
no,
of the disturbance of your vision. Okay.
no, no, Doctor.
Uh,
No. Okay.
uh, no weakness in your upper
No,
or lower
no,
limb.
no weakness, no weakness.
Okay. No change in your facial appearance or like that.
No, nobody noticed this.
Okay. No lose. No. You are not sorry about that. I will ask this question. No loss of your or no passage of water work or back benches during or after this disease
No,
phase.
Doctor. No, no.
Okay. Uh, so, Mr. Ahmed, there is any associate no يعني feeling sick or vomit during or after
No,
or any
Doctor.
symptom like this?
No, no, no feeling sick.
Any weight change
What changes to Doctora? Really, I feel that my weight drops around 5 kilogram over the 6 months.
or 6 months? Is it intentional?
No, doctor, no, not intentional. I'm eating well.
Any increase of your body temperature, like increase your
No,
body temperature? Is
no,
this weight loss?
no,
No.
it's okay. No,
No sweating, night sweat or sweating.
no, no, no.
Okay. Any tummy pain?
Not tummy pain exactly, doctora, but I feel like bloating in my tummy most of the time.
Most of the time. Any loss of appetite or
No appetite. My
this,
appetite is it's okay. I'm eating well, doctora.
okay, but you feel bloating these days.
Yeah.
Okay. Any loose motion? Any loose motion, Mr. Ahmed? Hello? Hello?
Hear me?
Yes, yes, Mr. Ahmed.
Yes, yes,
Any
doctora. I has loose motion since long time, maybe 1 year or more.
junior or more? You seek, sorry about that. You seek any medical advice before for this loose
Really,
motion?
doctor, I didn't seek medical advice because not frequently, but more nowadays become more frequent.
Okay. How amount of this? How much this loose motion per day
Actually,
exactly?
doctor, not all days, but sometimes I can open sometimes my bowel 6 times or more.
Is this watery or is there is any
Not
blood or
watery,
milk
no. Not only loose, doctor.
only loose? Okay. It is feel difficult to flush it or
Actually, yes, doctor. When I have this loose motion, I feel difficult to flush it.
okay. Is there is any association with this loose motion? Any skin rash? Any
No, no
like
skin rash.
okay. Um, Okay, any change in your eyes change it, you notice is it change to yellowish or your skin change to yellowish discoloration or no change?
Not yellowish, doctora, but really many of my friends comment that I become paler.
Became paler these days.
Since long time, my friends comment that I'm better, but really I notice it only soon, about 2 weeks or 3 weeks. I notice it.
You feel easy fatigue when you do
Yeah, really,
when
really,
you do
doctor. Yes, yes. I feel tiredness. I feel tiredness. Yes, no energy.
activity. I want to ask you some question. You can say yes or no. Is that okay
Yes,
with you?
doctor. Yes, please.
Do you feel any shortness of breathing nowadays?
Really, doctor. I have shortness of breath when walking fast or climbing stairs.
Okay. Any racing of your heart associated with shortness of breathing?
Any raise?
Racing of your heartbeat.
Yeah. Also, I feel awareness of heartbeat when also I'm walking fast.
Since when this symptom started?
Also, since around few months, 1 month or 2 months like this.
Okay, sorry about that. Any cough?
Cough, no cough.
Any chest pain with this
No
symptom
chest,
also?
no chest pain, doctora.
Any change in your water work? Yeah, like
Really, doctora,
increasing.
I'm awaking many times at night because I want to pass urine.
This symptom start recently. You have
No, no, I have
diagnosis
this symptom since long time, really, doctora.
sometime. How much you get from your sleep to go to the bathroom?
Sometimes 1 time, sometimes more, 2 times like this. I feel that because I'm drinking more fluids, liquids.
Yeah. Any associated pain in your water work?
No, 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 no pain, no burning.
Any loin pain, any pain anywhere?
No lung pain, doctor, no.
No joint pain,
I have no joint pain.
muscle ache. You told me you have easy fatigue nowadays. Also
Yeah.
associated with muscle ache.
No muscle ache, doctor. Only I feel that no energy to do some activities, especially that need effort.
Okay. You feel any numbness in your lower extremities, in your hand and feet,
Actually,
like that?
doctor, not numbness. I think burning pain, burning sensation in my feet, especially at night when I'm going to sleep.
Since when?
This is since long time, really, doctora. It's around now about 6 months or more.
Okay. Any change in your vision with this also, or
No change in vision. I check my vision regularly, and eye doctor told me that you have this is early stages of a diabetic eye disease, and only need to control my blood sugar. No need anything now.
okay, okay, Mr. Ahmed. Can you tell me more about your past medical history? You have diabetes. Is it
Yes,
controlled?
doctor. Yes, I have diabetes since I was 15 years.
15 years on insulin since the start.
Yeah,
Is there
yes,
is
doctor.
any?
Yes, yes, yes. I'm
Yes,
on Hemulin.
yes. An increase in your dose recently, or like that?
No, no, same dose, same dose.
And okay, is it control your weight loss, blood sugar? You mean there?
Actually, doctora, my GP always told me that your blood sugar not good.
Not control me.
Yeah, yeah, really.
What about your diet?
My diet, really, I cannot follow a restricted diet as my GP advised me to do. You know, sister, I'm young man. I need to eat and
Okay, okay, I strongly advise you to strict your diet control as your GP advice, and will give you some diet
I will
control.
try, doctor. I will try. Thank you. Thank you for advice.
What
Thank you
about
for
your
advice. I will try.
okay, what about your exercise? You practice exercise daily, or
Really, doctor, I am lazy man. I don't do much exercise.
mm, okay. Any other history, any other past medical history, or have any high blood pressure?
Only I am diabetes. No,
Okay,
doctor. Only I
any
have
hos
diabetes.
any hospital admission before?
Yeah, doctor, I have many admission in hospital because sometimes I have episodes of low blood sugar and sometimes high blood sugar.
Okay, sorry about that. When the last admission?
I think last admission about a few months before because low blood sugar. So for this reason, I don't take my medication well.
Any history of blood transfusion before?
No, no, I have no history of blood transfusion.
Uh, any family history of similar condition? Your
No, doctor, but my father has colon cancer and died because it.
okay, sorry about your father. Sorry about that. Any history or what about your medication? Other than insulin,
All,
you take any other medication?
all I'm taking insulin, doctor, only insulin.
Any over-counter medication?
No,
Uh, Sorry about that. Any recreational drug?
no, doctor.
Any allergy to any medication?
No. You have 2 minutes, doctor.
Okay. Okay. Mr. Ahmed, do you smoke?
Yes, doctor, I'm smoking only 10 cigarettes per day.
Okay. I'll advise you to stop this smoking, and I will refer you to smoking cessation clinic. Is that okay with
Thank
you?
you, doctor. Thank you very much. I will try. Thank you. Thank you very much. Thank you.
Okay. Mr. Ahmed, what is your concern now?
Doctor, really, I have concern because I have many symptoms. So what can be due to, doctor, these symptoms?
Okay, Mr. Ahmed, I highly appreciate your concern. Uh, from what you said to me, and also I want to examine you and to run for you some blood investigation. But most likely, you have this uncontrolled diabetes, impair your nervous system. This is what we call autonomic nervous system. It's impair, leading to
Yes.
symptoms that you have. So what we need to do now is to advise you to restrict your blood sugar and
Doctor, I afraid that this loose motion doctor, I'm afraid that this loose motion may be because colon cancer like my father.
I highly appreciate your concern, but it is lower. It is impossible in this condition. It is a bottom in the bottom of the list of our possibilities here today.
Yes.
Also, what of our differential, it may be associated this diabetes associated with other disturbance defensive system, what we called it Addison disease. So we need to do for you some investigation to rule out this
Appreciate,
possibility.
doctora. Thank you very much. Finish. Time
ثانية.
finish. Doctora,
Yes.
you are hearing me. First question for you before to go to the examiner questions. Do you
Okay.
ask patient about alcohol consumption?
Yes. I want to ask it, but my time is
Because
finished. Yes.
okay, because alcohol here is very important because he has burning sensation in his feet also, so we can rule other diagnosis of neuropathy.
Yes.
And also, I forget to ask you, when he tell you that my father has colon cancer, you should ask him at which age your father developed this cancer, because you can here answer his concern in a better way, especially if he told you that my father has colon cancer at old age, 65 or more. The other thing for diabetes mellitus, you should take more detailed history. You should ask me about control, about medication, change medication, very nice. But you don't ask me about the complication. You don't ask me about stroke, about heart attack, about kidney functions. You don't ask me about the other
Chest pain, I
autonomic
ask
symptoms.
you about chest
Yeah,
pain
only
and
chest pain, but you should ask the patient if he has any now he has no chest pain because, but maybe he has heart attack before. And also you
yes,
should ask him about autonomic symptoms, all autonomic symptoms. If you
yes,
ask him about autonomic symptoms, to know that this is autonomic neuropathy, because he has only now one or two signs of autonomic neuropathy, dizziness and loose motion. But what about
yes,
the other sign of autonomic neuropathy that can be this patient has? Uh, okay. Now
yes.
the examiner questions. What's your diagnosis?
Top of my differential diagnosis here is autonomic neuropathy, uncontrolled diabetes, cause of
Yes.
uncontrolled diabetes.
Yes. The other.
Second one, associated autoimmune disease like Addison disease.
Yes. Okay. You,
Other
you ask me about the symptoms of Addison disease, like skin tanning,
diarrhea,
like
yeah, I can tell not ask about
yeah,
diarrhea, tummy pain, and
yes, right,
dizziness. Yes.
yes. What
Uh,
else?
else it could be
Why not?
dizziness.
Why not
Well,
celiac disease?
yeah, celiac disease. You ask you about skin rash associated with
Why don't ask
losing.
me when you approach the diarrhea?
Yes,
Why don't ask that? He told you that I have these symptoms on and off. So why don't ask him that if there's any type of food that can bring the symptoms? He will tell you yes, it increases when I'm
yes,
taking pasta or pizza. He will tell him.
yes,
He will tell you. Okay.
yes.
طيب. What are investigation you will do for this man?
Okay, we'll do for him first basic investigation or basic investigation, complete blood count and renal function test with electrolytes, liver function test. I will do for him celiac screening, and I will do for him another
Yes.
autoimmune associated autoimmune. Even I
Yes.
will do for him for this pernicious anemia that he's become nowadays become
Nice.
pale and like that.
Nice. Nice.
I will do for him also seek for short sensation test to rule out Addison. I will do for him
Yes. Very nice.
I will do for him diabetes related investigation or
Yes.
A1 hemoglobin A1C lipid profiles or this ECG
Very
chest
nice.
X-ray. Um, what else?
You will do biopsy, jejunal
I,
biopsy,
yes for celiac disease and
nerve conduction
autoimmune.
study you will do. You will do nerve
Yes,
conduction study for him also.
yes for complication.
طب,
Yes.
what are treatment for this patient?
What are
Treatment, management
treatment?
plan.
Yes, first of all, treatment restrict blood sugar control, diet control, exercise,
So first of
and
all, education, patient
education.
education,
Yes,
and counseling. Yes, and this patient
and
need multidisciplinary team. Why? Because he
multidisciplinary
has, as we see, have multiple complaint.
complication. Yes, my
And
lord.
for blood sugar, we should control blood sugar and advise him and refer him to dietitian also.
Yes.
For celiac disease, what you will do for him?
For celiac disease, you'll for treatment, I
Yes.
will advise for I will advise for gluten-free diet first, gluten-free free diet, and that is
So for diabetic autonomic neuropathy.
for there is some medication for dizziness I will prescribe for him.
Yes. طيب, what are the causes of orthostatic dizziness? Any patient has, like this patient, he told you, I feel dizzy when I stand. So this is called orthostatic dizziness. So what are
Yes.
differential diagnosis or what are the causes of this you should put in mind always?
Autonomic neuropathy,
Yes.
one is the cause. Also, Addison disease, one of the cause.
Yes. Yes.
Uh, okay, um, could be
The, the most important cause,
vasovagal attack, like
the most important cause is anemia
anemia. Yes. Yes.
and also drug induced. So we have four causes, main causes for orthostatic dizziness: anemia, Addison disease, autonomic neuropathy, drug-induced. Please don't forget because all these causes come in examination. All this, there are history for each one of this.
Yes.
Last question: what are the causes of autonomic neuropathy other than diabetes mellitus?
Other than diabetes.
Type. The other causes of a neuropathy can cause autonomic neuropathy, like alcohol, okay? And we have also amyloidosis, and also we have hereditary. We have Parkinson disease. Parkinson disease, important cause, multi-system
Yes.
atrophy, and syphilis. Okay, I need to ask you one important question, and this is for all really. When any patient tell you that I have uh, uh, recurrent episodes of hypoglycemia, you should ask him very important question here. If he has awareness or non-awareness hypoglycemic attack, what the benefit from this question?
Hypoglycemic attacks.
Yeah, if the patient has hypoglycemia, so you should ask him if he's aware to symptoms of hypoglycemia or not aware to symptoms of hypoglycemia. Ready? Yes, it's right.
The rifle.
Very nice, doctor. Very
Autonomic
nice.
neuropathy.
Very nice for autonomic neuropathy. This is very important question. And also for management plan, really, because the patient with non-awareness hypoglycemic attack, has dangerous consequences of this. So for autonomic neuropathy, this is very important question. Uh, Actually, any patient with dizziness, the approach for any patient with dizziness, really sometimes the patient can use many terms to prescribe dizziness. Sometimes the patient tell you that I like faint. Sometimes the patient tell you that I have funny turn. Sometimes the patient tell you collapse, but he has no collapse, only he has feeling dizzy. So you should tell first the question to ask the patient, what do you mean exactly by dizziness? Sometimes the patient use term dizziness for loss of consciousness, for seizure. Many patients come to my clinic, tell me, I feel dizzy. When I ask him, he has seizure. So first question should be, what do you mean exactly by dizziness? Okay? Is vertigo, is seizure, is loss of consciousness, is pre-syncope or syncope, all this. First question. After that, you should ask patient about the onset of symptoms. It comes suddenly or it comes gradually. Then the course. How many times estimate in the average of day, of month, of year, according to what he told you. Then the duration. How long the episode lasts. This patient tell you only second. Then the next important question after that, you should, what you were doing when developed these symptoms, what you were doing. Because if the patient told you, I was standing for long time in hot weather or under stressful, so this can give you clue that vasovagal syncope. When the patient tell you, I feel dizzy when I stand, so this gives you clue that this has orthostatic hypotension or orthostatic dizziness, and we told the cause before. If the patient told you, I feel dizzy when exercise or with exercise, so maybe indicate cardiac cause. When he told you that when I shave my peer, or yes, so this can indicate carotid artery hypersensitivity. Maybe the patient has situational syncope, this is with cough, with micturition, with defecation, so this is very important. So next or third question, what you were doing when developed these symptoms. Fourth question and important question, did you check your blood sugar or anyone check your blood sugar and blood pressure? Maybe if this patient diabetic, so did he check his blood sugar when he feels dizzy? Maybe he has hypoglycemic attack. Then, according to the scenario, you can follow the approach. So here in our scenario, this patient has orthostatic dizziness. So the differential diagnosis for this, as we mentioned, anemia, Addison, autonomic polyneuropathy, drug-induced. So when the patient tell you, I feel dizzy when I stand only for seconds and then I become normal, so this means this four differential diagnosis. Always start with anemia, rule out anemia, because anemia is important cause for other underlying disease. If the patient tells you, you find that this patient has symptoms of anemia, so you have long history, you should rule out also the other cause of anemia. Okay? The second one, Addison disease, then autonomic polyneuropathy, then drug-induced. Drug-induced, ask him if he has taking now any new medication or if there any change of the doses of medication. Maybe the patient was taking diuretics, مثلا thiazide 20 milligram, but now increase the dose. Maybe the patient increase the dose of amlodipine or ACE inhibitors. So this can also cause dizziness. Now, approach for anemia. When you find that this patient has anemia, first of all, ask him about the other symptoms of anemia. And when you find patient has pallor, ask him about the other symptoms like palpitation, shortness of breath, feeling fatigue, okay, chest pain. Then ask him about any source of bleeding. You don't ask me, doctor, about any source of bleeding. You don't ask me if he has blood with back passage. Then, after you ask source of bleeding, rule out malignancy. How can rule out malignancy? Ask patient if he have a significant change of weight, appetite. Then you should hear any history of anemia. The most important system is GI system. So the most important system in approach patient with anemia is GI. Why? Because most causes of anemia can be due to GI, like celiac disease, inflammatory bowel disease, colon cancer, peptic ulcer disease. Peptic ulcer disease come many times. The scenario is dizziness, and then the final diagnosis is peptic ulcer disease. Then ask patient about diet, if he has any change in the diet, what the type of food he is taking. He's taking all type of foods, or he's vegetarian, or so this can give you a clue about anemia. Rule out vitamin B12 deficiency by ask him about neurological symptoms. And any chronic illness. Any chronic illness, if the patient has any chronic illness, can cause anemia like rheumatoid arthritis, SLE, and other. When you have one autoimmune disease, you should rule out the others, especially that it's common to present together, like type 1 diabetes mellitus and celiac disease. Usually, it's common twin. Patient have type 1 diabetes and also have celiac disease. مثلا patient has like Addison disease, you should rule out thyroid disease, vitiligo, and type 1 diabetes mellitus. So patient has Addison disease, you should rule out the other autoimmune disease that's common to come with Addison disease, like thyroid disease, either Graves or Hashimoto. like type 1 diabetes mellitus, like vitiligo. So this is very important. Patient with type 1 diabetes, you should rule out Addison. You should rule out thyroid disease also. You should rule out celiac disease. And also primary biliary cirrhosis. Even primary biliary cirrhosis, also autoimmune disease. When you have primary biliary cirrhosis, also you should rule out the other autoimmune disease. And the other also usually common rheumatoid arthritis, SLE, pernicious anemia. These diseases I mentioned now, it's common to come in one patient. Addison, thyroid disease, type 1 diabetes, celiac disease, vitiligo, primary biliary cirrhosis, rheumatoid arthritis, SLE, and pernicious anemia. Last thing I will mention now, how can any patient, especially in station 2, if you are in station 2, and it's mentioned for you in scenario, or when you ask patient, he told you, I have diabetes mellitus, not enough to only ask him what the dose and it's control or not control. No, you should ask him when it starts, at which age he has diabetes. You don't ask me, because you know if the patient develop, because if the patient have type 1 diabetes and since 2 years only, so he will not develop complication of diabetes. He need at least 5 to 8 years to develop complication, type 1 diabetes, and type 2 need 10 years to develop complication. So first ask him about onset, when he was diagnosed as diabetes. Second question, it's controlled well or no. And ask him what was last HbA1c, and if he checked his blood sugar at home, and what the average reading of fasting blood sugar at home. Then ask him about medication, whether he is compliant to medication or no, any change in the doses, very important, and ask him if he has any side effect. Like this patient, if you ask him, he will tell you, yes, I have many episodes of low blood sugar. Then go to the complication. Has admitted before in hospital because hypoglycemia or hyperglycemia. Ask about microvascular, heart attack, stroke or mini stroke, and peripheral vascular disease. And microvascular, neuropathy, retinopathy, nephropathy. And then go to the ulcers, if he has any foot ulcers. And then ask him about hypoglycemic attack, if it's awareness or non-awareness. And then ask him about autonomic polyneuropathy. What are the symptoms of autonomic polyneuropathy? Orthostatic hypotension, recurrent vomiting, early satiety, change bowel habits, urine retention, and sometimes increased frequency or nocturia, especially at the early stage. Only the patient has nocturia. For this reason, this patient has past urine, has nocturia. Last thing, you should ask him about diet and exercise, and please don't forget DVLA. Especially that this patient, you forget, doctor, to ask me about driving, because it's very important and very critical for this patient to ask him about driving, especially he has recurrent hypoglycemic attack and he feel dizzy. So any patient with, especially with, if he's on insulin, you should ask him about DVLA. Especially if he has recurrent attack of hypoglycemia, you should advise him to stop driving and counsel DVLA. This is everything about this case. I think it's interesting case, and really it come in examination in Diet 3 to 2019. And it repeated, really, many times they bring case that patient have dizziness, and also known case of diabetes, and finally he has either Addison disease or he has other autoimmune disease like celiac disease, or the patient not taking his drug well, or has no autonomic neuropathy. This scenario, it repeated many times, really. I saw many scenarios like this, but every time there is other diagnosis. I can receive your question.
Hello,
About
Dr. Hassan.
Yes, I will start.
Hello.
Doctora, yes?
Dr. Hassan, you have told about the signs and symptoms of autonomic neuropathy. These were dizziness, early satiety, change in bowel habit, and nocturia.
Yes.
These were the okay. No.
I mentioned also for symptoms of diabetic. Sorry, I will explain it.
Okay.
Recurrent vomiting, early satiety, change bowel habits, urine retention, and sometimes increased frequency and nocturia. What the question you will ask patient for early satiety? In public language.
early fullness after taking small meals.
Yeah, yes, that's right.
Sir, it can also result in the erectile dysfunctions in
Can
men.
you
Again, doctor,
Yeah,
please.
yeah, very important. Really, erectile dysfunction, I forget it. And also, I really, if the doctor, she asked me, because I am right in my approach, if the doctor asked me in the scenario, do you have, are you married or in long-term relationship, I will tell her that I left my girlfriend because I have difficulties in intimate relationship since 1 year. This, yes, you are Dr. Tanzid, you are
Thank you.
right.
Thank you, sir.
Very important.
can you repeat how to ask about early sedative?
Early satiety, طبعا you should not ask the patient if you feel early satiety. You should ask him if you feel full or easy full just eating small meals.
Thank you.
Dr. About we are more concentrating about the investigation of autonomic neuropathy, especially in this case.
Yeah.
This
Actually,
is one
autonomic.
question.
Yeah, تفضل.
The other symptoms of autonomic neuropathy, if you change, if it happen blurring of vision, especially you changing your position from light to dark room.
Yeah. This is not autonomic neuropathy, doctor. This is neuropathy because this is affect proprioceptions, sensation, and this is sign of a neuropathy, not autonomic neuropathy.
I mean the pupil dilatation when you change from the light to the dark
this
room.
Is sign, this sign, not the symptoms. This is you are the one you will examine. But if you ask the patient if you feel dizzy or you cannot see well when you go from dark to from light to dark, so this means involvement of proprioceptions, sensations. So this means neuropathy, deep sensation. But yes, you are right. For pupil, this is sign. This is not symptoms because pupil, this is your job to examine it.
Yeah, but he will feel when he going from light room to the dark room, he will feel dizzy and blurring of vision because he lost the dilatation and the sympathetic dilatation of the pupil.
Yeah, I appreciate this. I cannot answer you well, but because usually when we examine this patient, when we ask him, when we ask the patient if he feel dizzy when change the light, so most of the time we ask it about proprioceptions. But this is good, notice. Thank you.
Other single head tilt test of autonomic neuropathy.
Yeah, you are right.
This is the investigation.
Tilt test, this is usually not for autonomic neuropathy. This is usually for vasovagal syncope. Tilt table, this is for vasovagal. Because what the etiology of feeling dizzy when the patient stand in patient, not only orthostatic hypotension, but this is the test for usually we use for vasovagal attack. But for autonomic neuropathy, there is one study, like nerve conduction study, there is special study for this. What's the treatment for orthostatic hypotension? Because I asked the doctor and she failed to answer me. Anyone
Sir,
know?
it's
Non-pharmacological and pharmacological.
Yes, non-pharmacological. What are
non-pharmacological education, counseling education about gradual standing from sitting position.
Nice. Very nice.
And about the diet also. I think
yes, diet. What about diet? What should I tell him about diet?
He can increase salt in diet.
And water.
And water in diet. Avoid hydration.
To eat small meals.
Small meals. Yeah, avoid hydration, avoid hot water like this. This is about the counseling.
And
he can take what called stroke. Leg stroke.
Compressive strokes. Yes. Usually up to at which level we should wear it?
Below the knee.
No.
Above the knee.
Above the knee. At the mid thigh. Yes, you are right. Mid thigh. Very important. And what medication we can use?
We can use neurotonic and duloxetine for peripheral neuropathy.
No, I mean for autonomic neuropathy or for autonomic hypotension. Fludrocortisone, very nice. And which other medication?
Midodrine.
Midodrine.
And Mido.
And what we can give him if the patient has frequent urination or he awake at night, also the other medication, oxybutynin.
Oxybutynin.
Oxybutynin,
Oxybutynin, very nice.
antimuscarinic.
Yeah, very nice. And also this can affect orthostatic hypotension. Yeah, if your patient have multiple urination and also have dizziness, hypotension, you can give him oxybutynin, can be affect both.
Okay.
Any other question, please, before to go to the other case?
Doctor, you
Now,
said
yes.
hypoglycemia with awareness, without awareness. Why is it important? I missed it.
Important because if the patient has non-awareness hypoglycemia, so this indicates autonomic neuropathy.
Okay.
But the other can come with Addison disease or with the other with decreased medication.
Okay. And how do we ask? Do you have palpitations, racing
Yeah,
of your heart?
you ask him if you feel, yani, you ask him because he told you that I have episodes of low blood sugar. So how can know that you have episodes of low blood sugar? Do you feel dizzy? Do you feel hungry? Do you feel sweaty? These are symptoms of, do you feel palpitation or awareness of heartbeat? These symptoms of hypoglycemia usually in the patient with awareness.
Okay. Dr. Hassan, so
Awareness.
this patient had autonomic neuropathy due to uncontrolled diabetes mellitus, along with peripheral neuropathy
Yeah,
and
this
celiac
patient,
disease,
yes, you are right, celiac disease also.
but no features of Addison's.
No Addison in this patient. But you should mention that I should investigate for Addison. He has no features for Addison, only this is hypoglycemia, but he has no skin tanning. And he has all symptoms of Addison except skin pigmentation. So you should tell in investigation, I will rule out also Addison disease. Like the doctor told me that I should do short synectin test to rule out Addison. You should tell the examiner, I will rule out Addison.
Okay. All right. Thank you so much.
Not aware by hypoglycemia. Not
Yeah.
feel any symptom.
No feel any symptoms. The patient found by his friends or by his people that he maybe collapsed or sweaty or like this. Also sweating, usually in autonomic neuropathy, sometimes the patient has no sweating.
Okay.
Because the nerves affected, so maybe the patient has no sweaty also.
Tachycardia, not happen for him tachycardia.
Yes, tachycardia
He
sign
lost the
of
tachycardia.
yeah. Also sometimes because neuropathy, sometimes the patient has no tachycardia because this is neuropathy affect. You know that neuropathy can affect. This is autonomic, can affect all the vagal nerves. Doctora Javeria. Next case.
Yes, Dr. Hassan.
Yes, I will share you the scenario and will give you only 4 minutes because, as told before, that in examination you have 5 minutes, but really while to shift from your station to the other station and while to sit and hold the pen, you will lose 1 minute. So only 4 minutes enough for now in our mock. This is your case,
Okay.
station 2. Station 4, sorry.